I'm Doreen Fukushima, a psychiatrist and owner and founder of Ho'ola Pono in Pearl City, Hawaii. I was never interested in psychiatry until I actually entered into it. I wanted to originally be a forensic pathologist before I entered medical school to solve murders and do autopsies, and when we got a sample of that, I found it wasn't for me because I like live people and there's not enough murders in Hawaii to go around. So when I started my third year, that's when we get to sample everything, the different specialties. And the first two I didn't think were for me. They were pediatrics and OB/GYN. And I actually took a year off of medical school because I told the dean I thought I made a mistake. He told me don't quit, take time off and reevaluate. Sometimes people get to this point. And when I came back, I started with psychiatry. And lo and behold, I didn't think I would like it, but I really loved it because it was the one specialty where they would tell me, take your time, get the person to trust you. You're gonna hear things from them that they won't tell a soul on this world. And that's a sacred relationship that has to be there for you to make change. So that's how I got into psychiatry. After I finished residency, I moved to the mainland and saw that there's a lot more resources there that I never knew existed. Different kinds of programming, different options for people rather than just the limited options we have here. So to come back and see that these are not offered here is a challenge because I want to bring them here, but it's been met with a lot of resistance to just offer some of the specialties I offer and to get it covered by insurance companies. In Hawaii, we have basically outpatient and inpatient. There's not a lot in between, very few. And when you start to get into specialty needs like children or geriatrics, even less so. So I'd love to bring programs where you have a step down. If you're not needing the hospital, a program with a lot of openings where you can go in for some days of the week but still go home, or an intensive outpatient where it's a few times a week of kind of a group therapy setting, and having something like that rather than inpatient, very restricted care, and outpatient, which outpatient doctors are pretty booked up. So if you try and get an appointment with me, it's going to be a couple of months, and that's not the best continuity of care coming right out of the hospital. So there's a lot of people that need help here. And it's with the shortage of doctors in general, it's rough in Hawaii. And when you try and get into the specialties like psychiatry or specialty surgeries, it's even scarce. And Oahu's actually better than being on an outer island. If you want to see a psychiatrist on an outer island, it's about a year wait. So can you imagine waiting for a year when you're suicidal? Just hang on to that, we'll get to you in a year. So this is the better island, but it takes several months to get in to see a psychiatrist. I'm a general psychiatrist, so I'm trained in age 18 and up. I can go down lower if there's not other options. And the specialties I am certified in are something called transcranial magnetic stimulation and S-ketamine or Spravato, which is a nasal spray. Both of them are used for depression. The magnetic treatment is also FDA approved for anxiety and obsessive compulsive disorder. With Hawaii being kind of on its own as the 50th state, a lot of people don't want to advocate for themselves, for their patients, against big corporations because they're afraid of the kickback. I do advocate, and I have had the struggles of when someone does that, what it's like. I have been cut off by insurance companies. I have to fight for patients because in the end, when an insurance company says they can't see me anymore, that person has nowhere to go. And that one person could be your next suicide, that could be your next shooter, and I'm trying to prevent that, but with no neighboring state, no neighboring county, we're kind of left to whatever happens to us, which is really hard for a lot of the patients here. When COVID happened, people came to a psychiatrist who never ever needed a psychiatrist before. They didn't understand why they couldn't sleep, why they couldn't eat, why they were scared to go outside. And they would think they were crazy, and I needed to talk to them that, this is depression, this is anxiety. No one's seen this in 100 years, we'll get through it. And with the current state of affairs, people are just struggling to not understand what's happening, how to deal with it, and just trying to keep people afloat and having them look to the positives as much as they can with how things are, and that they can't really do much to change it other than just try and live their life with their loved ones and their friends who keep them positive. I need a stress relief, so I enjoy soccer. I've always been a soccer player since I was 5. And I have some boys that I go and watch and cheer on, and sometimes I'll help them when they're kind of feeling low that they didn't perform well enough, and do a little training clinics because I've been playing soccer for 42 years. And once upon a time I thought about being a professional soccer player, but I guess I was glad I didn't. I'd be way beyond my prime at this point. But to go and coach them and show them that a sport that I really love, that's a great coping skill, like don't give up on it just because you had a bad game or you don't have a very supportive coach. I do some outreach. There's some people that are homeless not far from where my parents live, and I live with my parents. So I try and help them because Hawaii's a tough place to be. It's not like we can take a train to the next state that's cheaper. An airline ticket is a couple $100s, and if you don't have enough food to eat, how are you going to get off the island? So just trying to make it where they have some hope, because they're kind of looked upon as, outcasts of society, and they're hardworking people. They just, down on their luck right now. So just trying to get back to them. My goal is to eventually take my practice and expand it. I want to get a building where I can take this and make it expanded with the magnetic treatments and the nasal spray. And I also want to have my own pharmacy where I'll make sure we always have the medication stocked, where people aren't turned away or told they'll have like a $500 copay, which panics them. I want to have like a patient store, because I have a lot of patients that are very talented, and I think kind of the world threw them away because they've got bipolar disorder or PTSD, but they can paint, they can write, they can cook. I want a smash room and a trampoline room where you can bounce out your anxiety or hit it out, rather than going home and punching a hole in your wall or yelling at your family, and just healthy coping skills to get us through life, because we all go through stressors. I was appointed board of directors for, it was Aloha Medical Mission. It was a dental clinic in Honolulu, and they give free dental services to anybody, which that's really nice, because any kind of dental work is not covered usually by insurance. It's a separate plan, it's expensive, and your teeth matter a lot. Going for a job interview, having pain, it really affects your functioning. So I've been kind of helping them, making donations to keep them afloat, because they lost their donors, and they're doing such a free service. The dentists there volunteer their time, like a day or two a week. So that is so admirable, and I just want them to know that I'm trying to fight to keep them going, because you don't make millions, it shouldn't mean that you're kind of thrown to the side. Like, they have such a good mission that it should go on and be able to offer that even though they're not supported by the state. After residency, I moved to New Hampshire. It was one of the few states that allowed same-sex marriage back in the day. And I was married for 4 years, and it took me almost that long to get divorced. And when I was getting divorced, I had a lawyer in the beginning but didn't have one later, so I had to do all my own filings, court appearances, my own 2-day final hearing. And to have someone that I loved with all my heart, that I moved from Hawaii where I was born and raised, and to see like what this woman did, the betrayals on every level, it hurt. I will be honest and tell you, there were several times that I thought taking my life was a better answer, because there were so many tentacles in me that I just didn't know if I would get out of it, and it just didn't end for almost 4 years. But with going through that, you get stronger. It's a trauma, and I went through like a PTSD and anxiety, insomnia, nightmares, and now it's a struggle with what I deal with in the clinic, but nothing compares to that, because I don't love an insurance company. I don't love if someone's gone after me like I did that person and her children. So it hardened me a bit, but it made me, I guess, a hell of a fighter, because I'm a little kamikaze where I won't quit if I feel I'm fighting for justice. In psychiatry, we can self-reveal, and I do it quite a bit if it's going to help somebody, because I want them to know that, being a psychiatrist, I was trained, I read books, I learned all the signs, and it didn't matter. I still married someone that was a creature, and I learned my lesson, and I almost didn't make it. So when someone's sitting there thinking that I'm judging them, I tell them my story, and they're like, "Oh my God, doc, like you went through that?" I'm like, "Yes, I went through that, and I don't judge you. And if you need to be on that crazy train for longer, ride it as long as you need to. I rode mine for 4 years, and when you're ready, I'll help you get off. But you have to be ready." People told me to get off, and I didn't, because I was determined to fix it. But when times comes, we can put it together, and I can tell you the way that to get you out of it, and we'll get through together. Probably a noteworthy event in my history was the pandemic. With being in Hawaii and the shutdowns, I didn't close. A lot of doctors went to telemedicine and looking at people online. I never did, because the treatments require us to be here in person. So I stayed open, but my population dropped by half. And the people were too afraid to come in, worried about catching COVID. The other ones that were left, a lot of them wanted to come in more frequently, because this was the only out, besides going and get gas or the grocery store. So to see people through that and to get them acquainted with being in life again, going to the store and knowing that they weren't going to die if they encountered somebody who breathed on them, or going back to social settings, it was something to see. I don't know if, hopefully we don't encounter that ever again, but we've learned from it. And to kind of see people through that, and my patients now, when we go through things, I'm like, remember COVID? Remember where we were? Like, you overcame that. We can overcome this as well. Getting the awards from the Marquis who has helped. It's always nice to get an award, but in the end, I do this not for the fame or the fortune. That's not always what makes me happy at the end of the day. It's making people have some kind of happiness in life, or giving them that kind of cheerleading where they need to get through one more day. And eventually when we look back, we look back with people, I'm like, remember COVID years ago? And they're like, yeah, it's been a long time. Like, we can do it. It's just along the way, sometimes we need someone to be our light, our beacon of light. It means that even in mental health, we can be recognized for something that's needed, so that people can see, wow, if that psychiatrist got noted for something good, then it must be okay to see a psychiatrist, because a lot of people still have the stigma that they must be crazy or weak if they need to go talk to somebody about their feelings or need medication or a treatment. And it's really a strength. I tell people it is hard to come in here because you don't know what we're gonna say to you. I could tell you you're crazy, but I'm telling you, you're not crazy for coming in here. This is something that everybody needs someone to talk to. We've all been sad, we've all been scared, we've all been traumatized. If we pent it up, it's not gonna go anywhere. But if you talk about it, we can process it and you can become even stronger. I think I would just tell people that it's never too late. A lot of people think, I'm too old or I'm in too deep. There's no turning back from this, and that's not true. No matter what it is, no matter how old you are, no matter how far you sank, go talk to somebody. It doesn't always have to be a psychiatrist or a therapist. Talk to a friend, talk to a neighbor, talk to somebody at a social gathering that you trust. Just open up a little bit, because if you keep it closed to yourself, you're gonna go down a rabbit hole, and that's not good. You need someone to say, hey, it's not that bad. Let me take you to the next step, to a therapist or to the right person who can show you that probably what you're worried about will pass. You just need someone to reframe it for you. And it will change a lot of people's lives if you do, and if we can prevent someone from taking their life or someone else's life. We're all on a journey. And if we can do it together, all the better, because we're all human.